Namaskaram, Ashok Vyas, and these days are very, very special in several ways. But with problem, we think more about solutions. With challenges, we think about innovative ways to cross those obstacles and hurdles. And that approach we have seen being demonstrated by Consul General Sandeep Chakravorty ji here in New York, working with all Indian community members as well as those who are being served by this consulate. And at the same time, Indian government have also shown the kind of leadership which has earned good name for India. But where we are in terms of the complex situation, I have a distinct pleasure and honor of welcoming Sandeep Chakravorty ji to this program. Namaste, Sandeep ji. Welcome, sir.
Namaskar, Ashok ji, namaskar. Very happy to be on your show. And also, I'm delighted that you have chosen a very important and a very topical topic for discussion today.
So before I jump into the topic, allow me to take this opportunity of complimenting you on maintaining your poise, your calm, and the kind of strength that you have conveyed through various programs connecting with different cross-section of Indian American community. Before we get to the formal conversation, if you care to share the secret, because when one is faced with uncertainty, it is very easy to lose focus. What helps you?
Dekhi, I think what we thought when we entered lockdown here is that the Indian American community is doubly affected. It is affected by what is happening in the US. Particularly New York has been the epicenter of the epicenter actually. And so our lives have been disrupted by the situation in New York, New Jersey, and in the Northeast. And also we are sentimentally and emotionally connected to India. And, we are affected by what's happening in India. So we thought that, lockdown for us doesn't mean that, we shut shop. We just, physical lockdown did happen. But, thanks to technology and thanks to science, we have various other tools at our hands. And, I always tell my team that, if you prepare in peace, you're ready for war. So we had these assets on the ground in terms of our technology and social media platforms. And we were able to use them. And, we didn't spare even a minute in reaching out to the community because we thought that at this time the community needs us the most.
The major concern now is people who are out of visa status. What would be their situation, and major concerns that you heard? If you just want to share a brief of the prime areas that are drawing your attention these days.
You see, there are two aspects of our work. One is reaching out and trying to help people in need. When I'm talking about people, I mean Indians who are here in terms of students or tourists or business people or parents of people who live here. They came here on a vacation and they have their visas are expiring, or it's time for them to go back home. So this is one group of people whom we are helping and reaching out on a regular basis. I was doing some mathematics that in the last few weeks, we have reached out to 18,000 people on telephone, on email, on our web application. And this does not include the interaction that we are having with people on social media. So basically, trying to get support for them. Students, sometimes it's accommodation, sometimes it's food, sometimes it is, getting them connected to a doctor. So this kind of a service we have, or, advising them on their visa status, or a lot of people are anxious to go back home, talking to them and telling them what are the options. The other group of activities, so this has been consuming a lot of our energy and time. The other group of activities are for people who are staying at home. So we are saying that you are doing your bit by staying at home. Let us do our bit by reaching to you at your home. So we have, if you have seen our social media platforms, doing a lot of programming. And the ideas for these programs are coming from the community. So we are using the resources from the community, and we are doing lots of events which are addressed to the well-being and health of our community members, or entertainment, or mental health, dental health, children, some education, some storytelling, some expert opinion. So we are trying to come out with a basket of programming, which earlier used to happen in the consulate, but now has gone online, and we feel that has generated a lot of connect between the consulate, because now in this lockdown situation, time and space have lost their meaning. अभी तो रविवार और सोमवार में कुछ ज्यादा फर्क दिखता नहीं है. And as you were saying yesterday, I think we are all working more now, because now there is no excuse that you are not in office, or you don't have time. I think time was the most scarce resource, and now it has become the most available resource. Just like oil was a very, very precious commodity, and we read reports that oil is now available. They will pay you if you lift oil now. So, the world has changed so dramatically, and we have reinvented ourselves. One is trying to become a first responder in many ways to people who need help. Some people have died. We have supported their funeral, their cremation. Some people are stranded. We are, there was some tragic cases I would like to illustrate. There was one girl, a student, and she was feeling sick, so she went for a COVID test, and she tested positive, and the hospital would not admit her because they said you are not very sick. And when she went back to her apartment, her flatmate said, no, you're COVID, so we won't let you in. And thanks again to our partnership with community organizations, we were able to get accommodation for her, and now she's safe. And so we worked till very late one night trying to arrange accommodation for. So one thing which is that in these trying circumstances, the good side of people are also showing, and there are lots of people who are extending their arm and in help to the consulate. So
there are cases that somebody lost his mother in India, some very close relation is no more. Now, they cannot be present there for the last rites, but is there any window or provision or possibility? What can you say when in such circumstances, is there anything?
देखिए, this is a recurring phenomena. Since the time we announced restrictions on visas, and since the time the commercial flights were suspended, lots of cases have come to our notice, and people are calling us and requesting us on a daily basis. But the point is that there is at the moment no way to reach India. You cannot walk and reach India, and there are no flights, no ships which go to India at the moment. Now we have to understand why this decision has been taken. First point to remember is that India is in complete lockdown, whereas US is not in lockdown. US is the US policy is known as shelter at home, and but the flights are flying, trains are operating, the road buses are working. In India, it's not like that, because the lockdown in India is much more severe, because the challenge in India is greater. We are a dense country with 1.3 billion people. So you have to understand that there is no way we are able to operate flights at this moment. And moment you take in foreigners or people who have lived abroad for some time, then there is this question of testing, question of quarantine. And as you know, as we have been hearing the White House briefings on a daily basis now, and as Dr. Tony Fauci is saying every day, everyone is a potential carrier. We could be asymptomatic carrier. We may not be showing the symptoms, or we may show mild symptoms. And that person can potentially infect many more. And so all of us are actually potentially, risky people to travel. And not only we can be risky, we can also pick up the infection from others. So international travel over long distance is certainly not recommended by anybody. And at the moment, our focus in India is to contain the problem within India and to solve the problem within India. So I'm sorry to say that at the moment, if our loved ones have passed away, or we are in bereavement, we have to endure for some more time till these flights resume. I don't think at the moment there is any possibility of going to India.
Sandeep, I appreciate that clarification coming from you, makes it sort of more clear. Now, talking about approach that America and India adopted to counter the challenge posed by corona virus, if on the face of it, would you say that there has been a different approach adopted by respective governments?
You see, the situation in every country is different, and the response of every country is different. I would like to focus my comments on what India is doing. India, as you know, is a dense country with 1.3 billion people, and our government, our leadership has shown the path for many countries. And I was talking to my colleagues in India recently, and they were telling me that many countries are just following what the playbook India has devised to deal with the crisis. So India has, in a way, our response is sui generis. There is no model that we have been using because you see that we could not use the China model because of how the way the country is structured. And we could not also use some other models which didn't seem to have given results. And I'm talking about some of the European countries. So we had to find a solution for our own country. And there you see our Prime Minister's leadership has shown, and also many chief ministers have shown leadership, and we have so many success stories coming out of India where our chief ministers have been on the ground and trying to solve the problems of people and trying to contain the virus. So if you see the statistics, the rate at which cases are doubling has actually reduced, or the number of days have increased. Earlier, there is the Brookings Institution, and Shamika Ravi is coming out with this data. It's a very reliable data. We could use it. And there I saw that a few days back it was 4 days doubling, then it became 7, and yesterday I saw it was 10 days. So the rate at which the virus is growing is less. And our strategy has many elements to it. One, of course, which is very one on everyone's lips is the lockdown. But we have a medical strategy. We have isolation beds. We have ICU beds. We have ventilators. We are having a medical approach. We are using testing. We are using medicines. ICMR has allowed several medicines to be used. There is work going on vaccination. There is cooperation, international cooperation, particularly in this context with the United States. So there is that level, and also there is this huge program of the government to support people whose lives have been disrupted by the lockdown and by the coronavirus. So millions of migrants are being housed in camps, and they are being fed. The numbers are staggering. I don't even want to mention the numbers, but there are millions of people are being supported. Money is going into their bank accounts. So huge operation is on in India, and I think because you see, what I want to say is that India has to succeed in defeating COVID. If India fails, then the world will fail, because we are 1/6 of humanity. And it is very important that the COVID virus expansion is stopped in India, because otherwise it will have very very grave implications and ramifications for the world. So I think our leadership is conscious of that. We saw the leadership of Prime Minister in the SARC initiative. We saw the leadership of Prime Minister in the G20 initiative, and he has been talking to all world leaders. And India is also, despite being in this difficult situation, we have not forgotten our friends. Medical equipment and medicines have been shipped to 60 countries. Whereas we need all these medicines also. We are aware of our international responsibilities, and we are making special arrangements to ship medicines to far-flung countries. But I think our focus is domestic, and I think our performance has so far been good. We need to keep.
Sandeep, I just take this opportunity once again to quickly ask you two questions related to India, and then we'll talk about US-Indo relationship in the context of the way this coronavirus crisis has brought various additional channels of communication. Now, one situation which we have seen recurring in different states is, we won't get into the details of the Jamaat Tablighi and then aftermath in various states, but there has been stone pelting on medical workers or on police, etc. Do you see that affects overall our fight against COVID-19 in India?
Well, I think these are stray incidents. I would not like to spend time in discussing. These are unfortunate incidents, and I think our government has come down strongly against. India is a big country. There are miscreants and people who don't, who they masquerade their private need and private good as public good. And somebody, child or son, or would have been positive and did not want to be in quarantine, and then they say that these people have come to infect you, whatever. So, but I think that the story is in general very positive, and there are many stories where communities have supported and applauded the work of our health professionals. Prime Minister led twice national celebration and support of the work of our medical professionals. There was on, I think, in March, there was an event where we all got out on our balconies and clapped for these people. And also on April 9th, we had this diya lighting ceremony. What was that? That was all, I think, gratitude to the Lord and gratitude to those people who are working day and night for us. So I think there has been spontaneous, all-round, nationwide support for health professionals. I think there have been a few incidents, stray incidents, but I don't think we should even ponder about them. Those are miscreants, criminal elements, and the law should deal with them. But on the whole, I think there is understanding of the gravity of the situation, and people have come forward to control it.
Yeah. So, Sandeep, I agree with you. Staying positive is important. Looking at the positive, call that narration, or the unfolding of the way we are handling it is important. But at the same time, I think sometimes it helps if we take cognizance of that which appears as negative, and we seek input from you. That way, we can look at it in a proper perspective and continue with this logic. If I may mention what today's headline tells us about the way in West Bengal, central medical team, and there was some confusion. Would you say these are just stray exceptions, or they may have some impact on the overall, call this a task to counter the challenge of coronavirus?
No, I think I would not like to get into these issues, because these issues in a huge country, in a federal structure with multiple layers of government, coordination issues will always be there. But I would just try to step back and look at the amazing innovation that has happened. 20,000 isolation beds have been created out of railway wagons and trains.
Absolutely.
I don't think any country has done that, and that story has not come out at all. It's only come out in the Indian media, but in the Western media, it has not come out. But I thought it was an excellently innovative step of our railway department and our railway minister to come out with these beds. So that has made so many beds available, and also many innovations are happening in terms of very affordable ventilators, in terms of use of various combination of medicines, in terms of our health professionals putting the lives in risk and treating people. Our administration, local administration, civil administration, police being very effectively used in enforcing the lockdown. Then distribution of food, lots of community organizations. I was just reading yesterday that this non-profit organization of which you also support is Akshay Patra. They are supplying 2 crore meals during this lockdown period. So they are amazing stories, and I think we need to look at the positive, because the negative will only pull us down. And as a diplomat, I am an optimist by training, and I always look at the positive, because even in if I get down to looking at the negatives in New York, there are many things to talk about, but I am looking at the positive. I am looking at the data that New York has peaked and it is declining. I was talking to doctors yesterday; they were saying that the admissions in hospitals has declined, and I think these are positive news, and we should celebrate them and look forward to a normal situation. But I would once again take you back to India, Ashokji. Pardon my doing that, but I think the effort that is going on in India is tremendous. Our state governments, our central government, our leadership, our prime minister, they're leading from the front, they're leading on the ground, and I think that will have a major impact. Otherwise,
sustaining your line of thinking, I just wanted to applaud that we need someone to off and on remind us to stay positive and look at that which is uplifting also. But again, we do it in our own way, being pragmatic and positive at the same time. But I think there is no doubt in the approach which Sandeep Chakravorty ji, Consul General Saab, has again underlined, that if what we look, that's what we find. So let us look at the positive, and indeed, I would again say be pragmatic, but being positive doesn't make us less pragmatic many times, especially in such circumstances. And Sandeep, with just few minutes that we have with us, a lot of people have lost their job, whether it is India or America, and the spirit that you are highlighting is very much needed once we move past this particular phase. From that point of view, and also in terms of Indo-US relationship at the moment, and we have heard President Trump mentioning India in a couple of his press conferences also.
One thing which is important to mention is that our relations were on a high. We had in February the a very successful visit of President Trump to India. We had the Namaste Trump event in Ahmedabad, and great discussions between our leadership. So and unfortunately for us, right after President Trump's return to the US, he got involved in the anti COVID issues, and the struggle and the battle of the country against COVID, and similar things happened in India. But here again, you will realize that cooperation between the two countries is taking place. President Trump and Prime Minister Modi had telephonic conversation. We have supplied medicines that are required by the United States. Our Foreign Minister, our External Affairs Minister, Dr. S. Jaishankar, has spoken several times with Secretary Pompeo. And there is also, if you see the interviews and the press briefings given by our ambassador, there is cooperation between Indian Council of Medical Research and US medical institutions, and they are doing cooperation in testing and in the vaccine and antibody research. So a lot of cooperation is happening. American companies, pharmaceutical companies are working with Indian companies, and vice versa. So that is happening at the moment. I think post-COVID, also we should look at the post-COVID scenario, how the world will look at. And there I think there is great scope of closer India-US cooperation. Lots of companies are looking at relocating to other geographies. There is a disruption in supply chain. The people would like to make sure that the supply chains don't get disturbed during these kind of problems. So, India will play an important role in the post-COVID world. And I would like to draw your attention to a recent essay or an article that our Prime Minister has written for LinkedIn. And you may wish to show it on this program as well, where he is talking of living in the COVID era, and he charts out a very important role for India in the post-COVID world. And if India is playing an important role in the post-COVID world, I'm sure it will have great impact and meaning for the Indo-US relationship.
So I think I am also reminded that there have been several wonderful fresh ideas from Prime Minister with respect to innovative approach. And when we enter into a world where most of the people are working from home, how Indians can take advantage of this as an opportunity, and all these inspiring ideas. A, a, a recent development, Consul General Sandeep ji, with respect to FDI rules, where India, again, this is in the context of the role that China seems to have played in the place where we are, not getting into that at length, but India trying to protect its companies from any aggressive intervention. So talk to us about that.
I think every country in the world looks at its national interest, and at the time of COVID, when there are certain vulnerabilities, I think every country would like to take steps which will guard and protect us from interests which are not in our favor, or which are inimical to our interests. So I think the government of India has taken some decisions with that in mind, and I support these decisions, and we'll see how it plays out, because at the moment, as the country is focused on anti-COVID strategy, we would not like to be distracted from that. So I think these decisions have to be seen in that context.
Yeah. Sandeep, as we move towards the concluding part of our conversation, I would request you to share your experience of having worked with Indian American community members, be it medical professionals or people from business world. How happy you are, or what is the additional suggestion that you may have for our community? And allow me to add, those who are feeling low, be students or those who have lost job, how uh, would you help them look at it with a different paradigm?
Thank you for this important question. I would like to say that there is need for more coordination, particularly as some of our people are sick, our doctors are sick, our community members are sick, and for instance, there is need for plasma donors. Now we did not have a mechanism where people can communicate very freely with each other, and the communication happens only in pockets. So I think post COVID or during this time, we need to come up with some very fluent communication structures where it's not that people we don't have the resources or people do not know. It's that some people have the resources and others do not know. That kind of a situation has emerged, and we have been fortunate that because we connect to lots of groups, we have played a coordinating role. But I think it should be played more within the community rather than through the consulate. So that is one point. I also want to say that this disease has affected our community, our doctors, our nurses. They are the front line. They have been sick. A lot of our people have been sick, and this is it's also a moment of pride that our people have given their lives for treating others. And please do not be lax. Please follow the stay-at-home advice. Please use mask if you go out, and maintain social distance and personal hygiene. Wash your hands. I think it's very, very important. That's the only way you can stop the virus from infecting you, because it's not that it's happening to others. It's happening to us. It's happening to you. It's happening to me. And we should be very, very careful. I think this is the message that people have been lax. People have been thinking that ये मेरे को नहीं होगा, औरों को होगा, and सब कुछ करने की कोशिश कर रहे हैं. It doesn't matter if you can't go to Patel Brothers pick up your grocery. It really doesn't matter. You can live on pizza. You can live on bread. Just make those choices which are good for you, and do not make mistakes. Because I know we have people in our consulate who have fallen sick, and it's a terrible thing to be in. And all of us know, Shokji, you also know, many of your friends and our common friends have fallen sick, and it has been very difficult, arduous journey for them, and some have recovered and some have not. So I just want to say, all of you who are listening to us, be careful, take the precautions, and if you live, you can fight for another day. Jaan hai to jahan hai, as Prime Minister Modi said. आप बिल्कुल नजरअंदाज मत कीजिए, ध्यान दीजिए स्वास्थ्य पे और अपने परिवार पे, और ऑर्डर्स को मानिए.
Make the right choices. I think that is the mantra which we gather with another mantra, that stay positive, from Sandeep Chakravorty ji. And if I request you to smile in the face of adversities, so that's what they say yogi does. So he smiles when it is difficult to smile. I just wanted to see Sandeep ji smile, and our viewers are also encouraged by you at every step. Such challenging circumstances also offer opportunities to dive within, look for additional dimensions that would help humanity. And I think Sandeep ji has done that. So I once again want to appreciate you and your team, sir.
Thank you. Thank you.
And I thank you all also, without repeating that stay at home and all those relevant words of wisdom shared by Sandeep ji with us too. With lots and lots of good wishes, hope we move past this phase very soon. Now, this is Ashok Vyas.